Dear doctors, in the last class we had discussed about the scope and limitations of homeopathy in various dermatological complaints, some interesting cases, some specific rubrics and medicines. Today we will discuss some entirely different set of dermatological complaints, its management and homeopathic approach. So this is a case of a diaper rash that is nowadays very common. Homeopathy can effectively manage this type of diaper rashes without any external applications. Ask your patient, the mother, to keep this area dry and clean without applying any ointments, without applying any powder or lotions. Keep this area dry. So the most important remedy that we found effective in this type of diaper rashes, that is medorinum. So the rubric in synthesis repertory, rectum, eruption and abort, rash in children, newborns. In majority of the cases, the medorinum is sufficient. In Murphy's repertory, some other rubrics are also listed. Murphy, that's the chapter, children, diaper rash, buttocks. The most important remedy that is mentioned it as sulfuric acid. That is also we found effective. Now a case of Dacryocystitis of 1 year duration. Dacryocystitis means infection of the lacrimal sac, secondary to obstruction of the nasolacrimal duct at the junction of the lacrimal sac. This complaint since last 1 year with the constant discharge, swelling below the left eye, and the patient is hypertensive and no diabetes mellitus, now with the severe pain. We prescribed the remedy 1 dose of pulsatilla 10 after repertorization. We took the following rubrics in this case. Mind disgust. That means she attempted many treatments like the allopathy, Ayurveda and these other conventional systems of medicine but miserably failed. So disgust means despair after repeated failures. Despair after repeated failures. So the rubric mind disgust. Mind weeping, telling her sickness when. Stomach distension, eating after. Rectum diarrhea, eating after aggravate. Stool odor offensive. Mouth indented tongue. That's an observation from the tongue. Indented. That means imprint of the teeth. Eye inflammation, lacrimal sac. That's a rubric for the Dacryocystitis. Then respiration, snoring, and generalities, hypertension. And we prescribe the remedy pulsatilla 10. See the before and after picture. On the left side, a swelling with a constant discharge and pain since last 1 year. And 1 week after prescribing the pulsatilla 10, see that area. So that is the beauty of homeopathy. Now, how you will work out this type of intertrigo or the ground itch? That is very common, especially in the rainy season, especially of those who are working outside. The rubric, extremities, excoriation, feet, sole. The two important remedies are malandrinum and silesia. Silesia is found to be effective in more than 80% of the cases. Now we'll discuss about the hirsutism. It is not so easy to manage, even though we corrected the menstrual problems, the hormonal levels, FSH, LH, the PCOD, this hair growth still remain. But with the help of the constitutional remedy, we can manage this type of hirsutism by giving the remedy for a long time. So the rubric in this case, skin, hairy, masculine in woman. That's a rubric represented in the complete repertory. The most important remedy, that is medorinum followed by cortisone and oleum jacoris aceri. In synthesis repertory, the rubric is generals, hair, distribution in woman, masculine. The most important remedy is sepia followed by corticosteroid and the baritacarb, etc. So we have to consider the associated complaints in treating the hirsutism. Her menstrual problems, whether there is any obesity, whether there is any hormonal imbalance, whether there is any acanthoses nigricans, all this type of concomitants that we have to consider. And along with that, we have to take this rubric either from complete repertory or from the synthesis repertory. So what is this condition? It's a typical ringworm infection. Nowadays, very common and very difficult with the conventional system of medicine. But homeopaths can manage this type of cases with a very high success rate. So the rubric for the ringworm infection, that is skin eruption herpetic circinatus. Skin eruption herpetic circinatus. Natrum muriaticum, sepia, tellurium, tuberculinum, etc. are the main remedies. But we have to differentiate these remedies. And there is a sub-rubric, rings intersecting, that means the rings like Olympic rings. Then the remedy is sepia. Spots in isolated, then the remedy is sepia. Then spring every, that means sepia. In clusters, another remedy is Dacryocystitis. So depending upon the nature of the lesion, we have to prescribe the remedy. And always take the case in detail. Then if that is on the inguinal region, if it is on the male, the rubric is male eruption herpetic genitals thighs between. The rubric for tinea cruris. Remember, the main remedy is petroleum and natron carb. Petroleum usually give wonderful results in the male tinea cruris. Similarly, in the case of female genitalia, eruption herpetic thighs between, lycopodium, natron carb and petroleum. So see the difference in the remedies. For the ringworm infection, the remedies are like sepia, tellurium, tuberculinum, etc. But for the tinea cruris, the organism is entirely different. In the earlier case, the organism is Malassezia furfur. But in the case of tinea cruris, trichophyton group of fungi. So the remedies are also entirely different. Petroleum and the natrum group of remedies are represented for the tinea cruris. And how we can manage this type of stretch mark? This may result after the pregnancy or from the sudden loss of weight after some obesity, this type of stretch mark. Two remedies that is mentioned in our literature, that is under trial in our college, that is sepia and cortisone. These are the two remedies mentioned for the stretch mark. The rubric is available in the synthesis repertory, and the main remedy that is represented in synthesis repertory is cortisone. So this type of stretch mark that may happen in upper limb also after a sudden emaciation from the obese condition. Now, this is a case of folliculitis, before and after prescription of 1 dose of the remedy. That means inflammation of the hair follicles. It is also very easy to manage. Usually this appears on the hairy parts with the severe itching, and the hair will fall out from that area. So the rubric in this case, skin eruption hairy parts. If there is hair fall in that area, the rubric skin eruption discharging, destroying the hair. Skin eruption discharging, destroying the hair, because the hair in that area disappearing. The remedies are natramur and rustos. Remember, the remedies are different. Then this is a hyperkeratotic eczema because of the constant scratching in eczema patient. Skin become thick and black. We can remove this condition with the help of our remedy. So the rubric in this case, skin become thick, scratching after. The most important remedy is rustox followed by lachesis, calibec, ranunculus bulbosus, etc. Skin thick, scratching after. This rubric is available even in Kent's repertory. Now these are all the conditions of the lichen planus without any treatment in the conventional methods of system. But we have good number of remedies to manage this lichen planus completely. So the rubric in the case of from the synthesis repertory, skin eruption lichen planus, that's a rubric. Antimonium crudum, arsenicum album, arsenicum iodatum, calibichromicum, etc. are the remedies. Give 1 dose of the remedy and wait. And if needed, you can repeat. And the complete repertory, the rubric is skin lichen planus. Some of the remedies like sulfur, then the lycopodium, sulfur iodatum, etc. are mentioned in complete repertory. So this is a case of psoriasis, otherwise called as the pustular psoriasis. This type of psoriasis that is very difficult to heal. We managed a few cases of this pustular psoriasis in our college. So this is the first slide, and see the second slide after the medication. But remember, psoriasis that may take a long time. Even though the entire lesions improved or cured completely, that may appear after 1 year or after 2 years. So if there are no lesion after 2 years without medication, that means the psoriasis is cured. No lesion without medication at least for 2 years. Then only we can consider the psoriasis as complete cure. The name of this, the age of the patient that complains with the gutted psoriasis. Otherwise, it is called as a gutted psoriasis or pustular psoriasis of 5 years duration that aggravates in sun and winter. And complaint started after taking some allopathic remedies for the gastrointestinal tract complaints. Is a well-day mechanic, and that is more on the back. Mapped tongue with the salivation, and this is complaints are aggravated by reading the newspapers about some horrible things or some accidents that may happen somewhere else. So we started with the remedy Maxol 0/3 in this case, and followed by Maxol 200 and 1 with the infrequent intervals. And lastly, we have given 1 dose of Sorianum also with a family history of psoriasis. In that way, we can completely cure the psoriasis. But it will take some more time, and always advise some diet restriction in the case of psoriasis. That is must, especially the non-vegetarian food, the curd, or some the shellfish, this prawn. These are all some of the things that we have to avoid, and the food contain chemicals like the Ajinomoto. So diet restriction along with some control over the stress, that is essential for the complete cure of psoriasis. This is a case of scalp psoriasis. And the scalp psoriasis, the remedies are somewhat different. See the rubric: head eruption, scalp psoriasis. Calcarea, meserium, sepia, sulfur, etc. are some of the remedies mentioned for the scalp psoriasis. In that case, we have to take the rubric separately. Then xanthelasma, raised brownish colored bumped lesions below and above the eyes. That is usually associated with a high cholesterol level that may found in patients without any cholesterol also. So it will take some time to get complete cure. The 2 remedies that is mentioned in our literature, that is graphitis and magnesia muriatica. These are the 2 remedies mentioned for the xanthelasma. You can take the other conditions like the mental journal, physical journals and particulars in addition to this rubric. And this is ACANTHOSES nigricans, that is usually associated with some menstrual irregularities, PCOD, obesity, some hormonal imbalance like FSH, LH, etc. So the rubric in this case, skin ACANTHOSES nigricans, arsenicum album, conium, naxomica, thuja are the main remedies represented in synthesis repertory for this condition. So we can remove the thickness and we can remove the discoloration within a short span of time with our remedies, provided we have to consider the associated complaints. Then freckles. This will take some more time to get improvement. The rubric face freckles. The main remedies lycopodium, phosphorus and sulfur. So these are all cases of the dermographism. That means we can draw the pictures on their shoulder, on their back, on their front, or their hand. Type of pressure urticaria. So, and this condition has no cure in the conventional system of medicine. We can offer complete cure in majority of the cases of the dermographism, but we have to select the specific rubric. See the dermographism, pressure urticaria. So one of the best rubric that is available in the complete repertory, skin redness, scratching after. That's a rubric. And the main remedies are sulfur, Maxol and Restox. In synthesis repertory, there is another rubric, skin discoloration, red, scratching after. Phosphorus and Sabadilla are the 2 remedies mentioned. So in majority of the cases, if you are doing a blood examination, the IgE level and absolute eosinophil count, that's usually very high in this case. You can compare the result before and after giving the remedy. And if it is made specifically because of pressure urticaria, then that means the urticaria on the pressure areas, bovista and medorinum. And medorinum is one of the best intercurrent in the case of chronic urticaria, especially the dermographism if other remedies fail. And the black discoloration around the eye. One of the main reasons for this black discoloration is anemia. So we have to check the blood level. You can check the blood level after your medication. So if you are correcting the anemia in major instances, we can correct this black discoloration below the eye. But we have to rule out some other complaints like this sleeplessness, stress, etc. So the rubric in this case is face discoloration, bluish, eyes circle around. That rubric is available in the chapter face in cancer repertory. Discoloration, bluish, eyes circle around. And something about the complexion also. We can improve the complexion of the individuals, especially after exposure to sun or after exposure to stress or after exposure to wind, this type of hair, this type of discolorations that we can improve to a great extent in majority of the cases. We have some good remedies for the to improving the complexion. That is mentioned in the rubrics like if you are searching on the Zomeo software, you will get a lot of rubrics related to the complexion, different types of complexion. In synthesis repertory, we will get some other specific rubrics for the discoloration after eruptions. The rubric: skin discoloration, spots, eruption after, ferrum, lachesis, rustox and thuja. Some type of eruption means discoloration, black discoloration that is remaining after the some type of eruptions. Then another rubric: face, discoloration, bluish spots following eruptions. This rubric we are using for the discoloration after the acne or pimples. The most important remedy that we found very effective in this case also, lachesis, followed by thuja. In complete repertory, the rubric is mentioned like this: skin, bluish spots, eruptions after. So even though the eruptions are relieved, the patient want to get the discoloration, get out from the discoloration. So that is where again they are coming. That is they are more concerned about their appearance rather than the diseases. So we have to use this rubric. And if that is on a white discoloration, skin eruption, pimples, white, scratching after, that area become white. The main remedy is arsenicum album, followed by the kali carbonicum, bovista, sulfur, etc. Another rubric: skin discoloration, blackish. That is a wonderful rubric available in cancer repertory and synthesis repertory for the black discoloration. Skin discoloration, black. We have to take this rubric in addition to the mental journals, physical journals and particulars of the patient. And the medicine for the long remaining discoloration after wound: leaden ball. Leaden ball is the best remedy for the discoloration after the mosquito bite, dark discoloration after the mosquito bite, or after some type of injury that colors still remain. So we have to prescribe it the higher potency of leaden ball in that case. Then PITYRIASIS. Homeopathy can offer wonderful results in PITYRIASIS also, but this may take a long time because that is on the epidermis. So this is the case, we can see this case, a case of a female, the PITYRIASIS since the last 2 years, with the intense itching that aggravates on perspiration, bathing and wetting, dryness of the mouth at night, menopausal hot flushes. So we prescribed the remedy sulfur 30 in this case, and without much benefit. So we prescribed sepia after detailed case taking. And again after many months, the patient again comes, and then we prescribed sepia 10 1 dose. So the rubric in this case: skin, PITYRIASIS of the skin. That's a direct rubric that is available in synthesis repertory, skin, and also in Murphy's repertory and complete repertory: skin, PITYRIASIS of the skin. Skin itching, perspiration during. Skin itching, scratching aggravates. Raw must scratch until. Until it's raw, she has to scratch. There are 3 rubrics are there: until it's red, and until it's bleed, and until it's raw. So select the exact rubric. That is even in cancer repertory, that rubric is available. Mouth dryness at night, general heat flushes of menopause during. That's the rubric for the menopausal hot flushes. Skin itching, perspiration aggravates. So we prescribe the remedy, see the result before and after. PITYRIASIS. Okay? Yes. Then fungal nails is also very difficult to cure by the allopathic medication. Antifungal ointment they are prescribing for a long time but without any benefit. But we have some specific remedies for this fungal nail. The rubric that is in the Murphy's repertory under the chapter feet fungus, antimonium crudum, graphitis, silicea and thuja are the remedies. In complete repertory there is a rubric extremities fungus growth nails. Medorinum is the most important remedy represented, followed by silicea and antimonium crudum. In synthesis repertory, the most important medicine represented for this type of fungal nails, that is silicea. The rubric extremities nail complaints of the remedy silicea. We will get wonderful result in this type of fungal infection. But everything depends upon the chronicity of the disease and the hygiene of the patient also. Then this is a molluscum contagiosum. So the main remedy that is represented in many of our literature is Maxol, but we usually give calcarea carb and the remedies like thuja. The rubric in synthesis repertory: skin eruption, molluscum contagiosum. 14 remedies are there, and the main remedy that we found very effective, that is Maxol. In complete repertory also, the most important remedy that is mentioned is Maxol, followed by sulfur and silicea. So that's about the molluscum contagiosum. Then detergent allergy. That is also a major concern among the housewives. We can manage this condition with 100% success. In Pathaka repertory and in synthesis repertory, some beautiful rubrics are available for detergent allergy. One rubric that is a skin eruption, soap application of. The natron carb and heroin are the best remedies. That means certain types of eruption appearing after the detergent or soap. Then the most important remedy, that is natron that we have to give in higher potency. Then the redness, if there is no eruption but there is severe redness and burning, then the most important remedy is a 3-mark remedy also, that is sulfur, that is mentioned in synthesis repertory and Padaka repertory. These 2 remedies that is sufficient to manage majority of the cases of the detergent allergy. Then intertrigo, that is very common in rainy season and also in those who are working in the working as farmers. So the rubric extremities, excoriation, feet, toes between. The most important remedy we found useful in this case is silesia. And ask the patient to keep that area dry. That is highly essential to get relief from this type of fungal infections. So excoriation, toes between, silesia, Barrett-Agar, Bisingam, Sanicula are the remedies. Similarly, for the nail complaints, we'll get many rubrics from even in Kent's repertory, like the brittle nails, curved nails, hang nails, thick nails, spotted nails, ingrowing toenails, crippled nails, corrugated nails, split nails. Corrugated nail means with the transverse ridges, split nails and thin nails. You have to observe this on your patient and select the most appropriate rubric in this case. Then this is a case of atopic dermatitis, and always convince the patient that it may take some more time to get a complete cure in the case of atopic dermatitis. It is not so easy as treating a case of eczema or the acne or something like that. It will take some more time, and the diet restriction that is also compulsory in the case of atopic dermatitis. So we have to combine these 3 rubrics: skin eruption, eczema, children in, face eruption, eczema, children in. The skin eruption, eczema, children, a good number of rubric medicines are represented in complete repertory, and that much of sufficient medicines are not there in synthesis repertory for the skin eruption, eczema, children. Very good number of remedies. And face eruption, eczema, children, if that is on the face. Then skin inflammation, dermatitis. The main remedies are for the atopic dermatitis, graphitis, sulfur and silesia. Prescribe the remedy in minute dose only and wait. Then if needed, you can repeat. Otherwise, it is better to avoid frequent repetition in atopic dermatitis. That will definitely spoil the case. So, homeopathy can offer wonderful results in atopic dermatitis. This atopic dermatitis has no effective treatment in conventional systems of medicine. Now, we can remove the discolorations of the teeth also. We will discuss some important rubrics. Discoloration of the black teeth, even after cleaning. And in streaks, there is a sub-rubric below that. In streaks, that means lines, black lines in the teeth. That is the remedies, Staphysacria. If there is black spot, then the remedies are creosote, lycopodium and scilla. And dark, there is a rubric, China and fluoric acid. Then sub-rubrics like the yellowish teeth, even after cleaning. And there is a sub-rubric, the teeth become yellow immediately after eating. Then the remedy is medorinum. Then something about the plaque formation in teeth, even after cleaning. First of all, we have to advise the clean teeth from a dentist. Then we have to give the remedy. It is very difficult to remove the plaque with the remedy, but we can remove the tendency to plaque formation with our remedy. So there is an arrow mark below that. You can see black sods means plaque. Black sods, China, conium, acetum, fluoricum. These are the main remedies for the plaque formation in teeth. So advise the patient to first clean the teeth from their dentist, then only give the remedy to prevent the recurrence of the recurrent plaque formation. There is one more sub-rubric, that is dark, China, fluoric acid, again that is represented. Now photodermatitis, see the image before and after. It is very easy to manage the photodermatitis also, but we have to select the specific rubrics and conditions. We will discuss about that. See the photograph before and after with the single remedy. Eruptions, rash, sunlight from. If there is an eruption appearing, rash appearing after the sunlight, so the camphor is a 3-mark remedy represented in our repertory. Then eruption vesicular, sun from exposure, then the remedy will change. In addition to the camphor, Kali iodatum and Staphysacria are the remedies. In general, there is type of eruptions in summer, then there is a rubric, skin eruption summer. Kali bichromicum is the remedy, followed by this calcareous carb, sepia and sulfur. Then if there is severe itching also, eruptions in summer, sweat itch, then the remedy will change, pulsatilla and sepia. So photodermatitis is comparatively very easy to manage with the help of the homeopathic remedy, but we have to select this type of specific rubric. See another image, before and after the remedy. And some of the rubrics in complete repertory, skin eruption, sun from. The main 3-mark remedies are sulfur, muriatic acid, astacus, kaliadatum, petroleum staphysaccharia. Then extremities eruption, forearm, sun aggravates. If there is only the photodermatitis on the forearm or the exposed areas, mainly if it is on the forearm, then the remedy is sulfur. Then skin itching, sun from. Remember, the parthenium is a very good remedy if there is severe itching on exposure to sun, but probably majority of the cases no eruption with the severe itching. Parthenium is a wonderful remedy. Now the medicines for the cement allergy. This is also a distressing condition, especially for the laborers. Cement allergy. We can prevent the tendency to this type of allergies with the help of our homeopathic remedies that we have to prescribe in very high potency later once the complaint is subsided. So the rubric that is available in Murphy's repertory and complete repertory also. That rubric is not there in synthesis repertory. Skin eruption, urticaria, nettle rash, cement off. Calcareous carb, petroleum, rust ox, silicea, natramor. And natramor is a remedy that we found in very effective in majority of the cases. So cement allergy. Then this is a koilonychia. That is a spoon-shaped nails because of the iron deficiency anemia. Then ichthyosis vulgaris. Ichthyosis vulgaris. The rubric, skin eruption, scaly, ichthyosis. That is a rubric for ichthyosis vulgaris. Tinea versicolor. So nowadays very common. The rubric, skin eruption, tinea versicolor. Or in certain cases, the rubric that is skin eruption, PITYRIASIS alba. That's another rubric is also there. Then neurofibroma. So never guarantee a complete cure with the help of our remedy. It will take a long time to improve this type of lesions and also to prevent the recurrence. We can prevent the recurrence early, but to completely eradicate it will take more time. So the rubric in neurofibroma, generalities, tumors, neurofibroma. That is a rubric in synthesis repertory. And in complete repertory, the rubric, generalities, tumor, neurofibromatosis. The main remedy, that is hypericum, phosphorus, etc. are the remedies given. And this is a case of cystic tumors that we recently treated in our college. Then it's a case of lipoma. Lipoma usually not need any treatment, but the patients are very much afraid about that. And if you are inquiring about the family history, some other members are also having the same disease, lipoma. It is a benign tumor, nothing to worry about that. No need to take the remedy. But if the patient is need compulsorily repeatedly asking you the remedy, then we have to give the remedy. The rubric, generalities, tumor, lipoma. That is a rubric in synthesis repertory. In complete repertory, again the tumor, lipoma, that is a remedy. In both cases, baryta carb is one of the main remedy, followed by calcarea, iodatum, phytolacca, etc. are the remedies. So we can prevent the further lesions with the help of our remedy and also reduce the size of the lipoma. Then rust poisoning. That is also very easy to manage. The rubric, skin eruption, rust poisoning. The two important remedies that we found very effective, that is anacardium and crotontic. Anacardium and crotontic. That is a remedy for the rust poisoning. Then allergy from non-vegetarian food. After taking the beef or after meat, the patient has urticaria or the reaction, then anaphylaxis, then the remedy is antimonium crudum. And always remember, depending upon the nature of the food intake, the remedies are entirely different. Never prescribe the sulfur or arsenicum album for a patient with urticaria or the anaphylaxis from after taking meat. The remedy is antimonium crudum. After taking the prawn, the remedy is bromium or the lycopodium. So depending upon the type of food, the remedies are entirely different. So we have to select this rubric from the chapter skin eruption urticaria. Many food items are there listed. If there is a reaction from the milk, then the main remedy is sepia. Another remedy is tuberculinum for the reaction or the complaints from taking milk. So depending upon the nature of the food, the medicines are different. And this is a case of psoriasis. Linear warts. As we discussed in the last class, Depending upon the nature of the lesion and the location, we have to select the remedy for the warts. Again, atopic dermatitis. Which rubric will work out for this type of eruption? Especially on the folds of the skin in children. Atopic dermatitis. There is a beautiful rubric in the chapter of synthesis repertory. Skin eruption, folds of skin. The main remedies are arsenicum album, natramor. Another remedy is sorinum. This is usually found in soles only, atopic dermatitis. So that is a wonderful rubric in that case. Then a case of chloasma of 1 year duration, menopause after. And there is a phelon on the right index finger, perspiration with the yellow stains. That means the nature of the perspiration, that also we can improve. And past history of contact dermatitis, and the main remedy for the chloasma of the menopausal season, that is the plumbum metallicum, is the main remedy that we have tried in 200 1M 10M, and we have given 1 dose of sulfur 10M as an intercurrent remedy, and the patient is still under our treatment. That is improved to a great extent. Then cones. In the case of cones also, depending upon the location and the nature, the remedies are entirely different. See the rubric. Extremities cone, painful, inflamed cones. The two important remedies are silicea and sulfur. Antimonium chloride is only 2 mark. Then painful cones. Only 3 mark remedy for the severe painful cone, that is sulfur. Followed by 2 mark remedies like antimonium chloride, calcarea sulf, hepa sulf, etc. Then boils like ulcerated as if, pinching, pressing, etc. So give importance to the sub-rubric and select the required rubric only. Then plantar cracks, palmoplantar cracks. That is also very common nowadays. I don't know, because of the use of some type of low quality chapels or because of the pesticides, especially in the farmers and the common man, that is nowadays very common. So in this case also we have some specific rubrics in this case. The rubric extremities cracked skin, that is a rubric in Kent's repertory, synthesis and Murphy's repertory. Extremities cracked skin, feet, and we have to select the rubric also. If the crack is on the heels, see on the next sub rubric, heels, crack is on the heel, then the remedies are somewhat different. Then soles. If the crack is only on the soles, not in the entire feet, the main remedy is arsenicum album, sarsaparilla, etc. Bleeding, lycopodium, and the cracks on the fingers, another set of remedy. Then there is a condition called, another condition, that is prickly heat, milia. That is usually in summer. So the rubric, skin eruption, milia rubra, children. If that is on the children only, then the remedy, milia rubra. Children in infants, aconite, chamomilla. And that's usually found disappear with the proper cleaning also. Don't worry about this type of lesion, especially on the face of the children. The two important remedies are aconite and chamomilla. 2 variants are there, milia, that is found in children, and in prickly heat, that is usually, especially in adults. Then exfoliation of the palms, maybe because of some contact dermatitis or because of the exposure to detergent, whatever it may be. The rubric, skin eruption, desquamating. If it is on the extremities only, extremities eruption, desquamating. That means exfoliation of the palms. So this is a case of herpes zoster. Herpes zoster usually found only on the one half of the body. It will never cross the midline. If it crosses the midline, that means the patient has HIV infection, acquired immunity deficiency syndrome. It will never cross the midline. Sorry, I mean this herpes zoster. And this is usually found in patients, they already had this chickenpox earlier. If the mother had chickenpox at the time of pregnancy, the child will get herpes zoster, even though the child is not affected with the chickenpox earlier. So this is usually found only after a patient infected with the chickenpox in the previous history. So depending upon the area of the herpes zoster, the remedies are different. And we have the allopathy, they used to prescribe a lot of painkillers for this herpetic neuralgia, but we can manage with the little medicines with this type of post-herpetic neuralgia completely. So the rubric, for example, in the case of chest eruption, herpes zoster zona. And the remedies are different. For the left-sided, the ranunculus bulbosus is the main remedy for the chest. And similarly, abdomen eruption, herpes zona. Iris versicolor is a medicine. And if it is on the right side, the remedy is iris versicolor and thuja. And the remedies for the post-herpetic neuralgia, meserium and ranunculus bulbosus. These are the two remedies that is mentioned in our literature for the post-herpetic neuralgia. Even though the complaint that is completely healed, the lesion completely healed, the neuralgia that may last for weeks or months. It's an intolerable condition. Allopaths used to prescribe this remedy, allopathic remedies, the painkillers for a long time, but without any improvement. But we need only two remedies, either meserium or ranunculus bulbosus. Initially in the repeated dose, followed by the higher potency if required. Then another rubric, back pain herpes zoster after. See, if the herpes zoster is on the back side, there are one of the remedy that is on the lachesis. So, if you are searching through the different chapters of the repertory for the medicine for the herpes zoster, the remedies are entirely different, and we always prescribe based on the site. But for the post-herpetic neuralgia, we have with the two remedies, meserium and ranunculus bulbosus, is sufficient in majority of the cases. Now, a wonderful case of epidermolysis bullosa. That means a group of rare genetic condition that results in easy blistering of the skin and mucous membrane. Blisters occurs with minor trauma or friction and are painful. That is a condition. In children, it's a congenital condition or maybe a genetic condition because of genetic predisposition. Blisters occurs with minor trauma or friction and are very painful. And we have a case of a female, 1.5 years old child, epidermolysis bullosa since birth. More on the extensor aspect, and there is a consanguineous relations also. That means the father and mother are blood relatives. That may be the reason for this genetic condition. And the child has perspiration on the scalp. We prescribe the two remedies like the phosphorus and the lachesis. These are the two remedies that prescribed over a time. Initially, we started with the remedy phosphorus tenum because phosphorus is the remedy that is mentioned in our literature for the complaints from consanguineous relation. The complaints occur to the children because the parents are blood relatives. So, these are the rubric we took in this case: skin eruption, vesicular desquamating, skin eruption, vesicular itching, general syphilis, probably syphilitic miasm, teeth crumbling, that child has crumbling of the teeth, skin eruption bleeding, mind fear doctors, skin eruption pemphigus, and that is on another clipboard, rectum constipation, painful. So, this is a condition at the time of giving the medicine, the first consultation in our OPD, and the patient is gradually improved with the remedy lachesis in this case. Initially, we prescribed a phosphorus tenum. Now, the patient is under lachesis tenum with a great, comparatively very good improvement in this case. Now, there are not much lesions after, the scratching or some pressure. So, this is a wonderful case of scabies. This scabies that is from our college itself, one student from our college. Many students contracted the same disease. And within one day, with the help of the remedy sorinum, we got this much of improvement. Within one day after prescribing the sorinum, see the condition. And see the condition after 5 days. But in scabies, we have to select the remedy, proper remedy, and you have to prescribe it in high potency. The rubric is skin eruption scabies. If there are recurrent scabies infection, then the remedy again that is mentioned in our literature, that is sorinum. Bleeding, calcaria carb, dalcamara, Maxol, sulfur. Bakesin, psoriasis, lycopodium is the main remedy. Pustular psoriasis, the remedies are causticum, lycopodium and sulfur. And in this case, we selected this rubric, extremities eruption, itch-like scabies of hands. This is a rubric from complete repertory. For the scabies of hand, the two important remedies that is we found very effective is sepia and sorinum. So for this doctor, we prescribed the remedy sorinum tenum, 1 dose of the remedy. Now, which remedy will prescribe for the scar mark of chickenpox? The two important remedies that is mentioned, calibromatum and calibichromicum. Calibromatum for the superficial scar and calibichromicum for the deep scar after chickenpox. And you can prescribe the thiocyanum 3x or 6s continuously for a short time along with the main remedy. Thiocyanum is a very good scar remover according to many doctors. So that's about the scar of chickenpox. Then this is a case of eczema. The rubrics: skin eruption eczema, skin eruption eczema children in, skin eruption eczema chronic, skin eruption eczema severe itching. There are some beautiful sub-rubrics are there. You have to select that sub-rubric. Now, which remedy we will prescribe to remove the discoloration after burns? Discoloration after burns, the remedies are somewhat different from that of discoloration after eruption. The main remedy for the discoloration, this type of white discoloration after burns, that is causticum. Another remedy is lead and pall for the chronic effects of the long remaining discoloration. So, one of the best remedy that we found effective, that is a causticum is a remedy, and causticum need to be repeated frequently. That is mentioned even in Borax Materia Medica, even though that is a mineral remedy that may need more repetition. Now, what about the obesity? That is also a concern nowadays. You look like what you are eating. So, always select the sub-rubrics. If you are treating an obese patient, never give the phytolacca berry to the all patients. It will never get a complete improvement for the obesity. So, some beautiful rubrics are there in the complete repertory. Obesity, that is the main rubric. Obesity, children in, there is a rubric. Obesity, climacteric period, the main remedy, that is graphitis, obesity during climacteric period. Then obesity after delivery, the remedy, that is Kali carbonicum, that is the remedy mentioned for the obesity after delivery. Then obesity with the dysfunction of ovaries, some ovarian complaints, a group of remedies represented. Obesity after grief, obesity hardness of muscles with obesity hormonal, if the patient is under thyroid complaint, or if the patient is under some treatment for the polycystic ovarian disease, that may also result in obesity. Then the main remedy is thyroidinum, followed by the ribolic acid, fucus vesiculosus, calcarea carb, etc. are the remedies. Obesity, hormonal thyroid gland, there is another sub-rubric. Thyroid enlargement with obesity. The two important remedies are calcarea carb and fucus vesiculosus. Fucus vesiculosus we are usually giving in mother teacher form if there is an obesity with the thyroid enlargement. That offer very good results. Then obesity menses before, obesity menses irregular with, obesity menses candy with, then obesity old people in. So there is another set of remedy. Obesity sedentary habits aggravates. Obesity with the thin legs. That means their buttocks and upper part, that is more obese, but the legs are thin. Antimonium crudum and ammonium more are the remedy. Then obesity woman in. Graphitis, calcarea carb, sepia, thyroidinum, etc. are the remedies. Then obesity young people in. There is another set of rubric. Obesity young children. And obesity young people or children, fat anemic babies with ravenous appetite. He used to take a large quantity of food. Lapis albus is a remedy. Appetite with ravenous appetite with obesity. Then the remedy is lapis albus. Then young girls, the remedy is calcarea carb. Then remedies fail to act when well selected in obesity. Even though you are given some good remedies for the obesity, if it is not acting, then the remedy that is mentioned is capsicum in complete repertory. See another set of wonderful rubrics in synthesis repertory for the management of obesity. Obesity men in, women in, children in, nursing children, thyroid gland from dysfunction of, obesity from thyroid gland dysfunction. Then endocrine, 3 remedies are represented. Hormonal imbalance, flabby, menopause during, nutrition from improper, old people in, ovariectomy after, slightly overweight, young people in, abdomen. That means obesity of the abdomen. There is a wonderful remedy that is mentioned in synthesis repertory. Legs thin, body fat. Again, ammonium ore is the main remedy. And obesity of the thigh and buttocks. Then 2 remedies are represented in synthesis repertory. So, depending upon the nature of the obesity and the age period, you have to select the appropriate rubric. And also for related to some hormonal imbalance, or from thyroid enlargement for ovarian complaints or whatever it may be, we have to select the specific rubric. Then only we will get the decided result in the obesity, and we have to add some exercise also. Especially if there is the abdomen is enlarged, or because the majority of the ladies or male or female, the fatty deposition that occur first in around the umbilicus. So the abdominal exercise is an unavoidable thing in the management of obesity. So that's in brief about the management of obesity. Now about the intertrigo in children. That's very common nowadays. This type of eruptions in the infants, in the neck or in the axilla or in the buttock area. So the main remedy, that is the one and only remedy that is mentioned in many of our literature, that is causticum. And the rubric in complete repertory, skin, intertrigo, dentition during, causticum and lycopodium are represented. But in more than 90% of the cases, we will get complete cure with the causticum, this type of intertrigo. And one thing you have to advise the mother that they keep this area very clean. Never apply powder, never apply any oil. Always keep dry. There is a custom in our country that is that's application of lot of powders in this type of area, axilla, this below the neck or inguinal region. So the powders that is not at all required for children, that we have to advise. Then this is a case of hand, mouth and foot disease. Hand, mouth and foot disease. That is mimicking the chickenpox, but don't worry, it's a very easily manageable condition. Two remedies are required in this case, either Restox or Maxol. Find out the remedy, which one is most suitable in this case, and give only single dose of the remedy. That is sufficient in majority of the cases. If needed, you can repeat after some days only. So very easily manageable condition, hand, mouth, foot, fever disease. Then allergic to chemicals. And this in this patient, this happened after application of the gel during ultrasonography. That is resulted in the severe reaction and this type of discoloration. So how we can manage this type of discoloration for this type of reactions to the chemicals? In synthesis repertoire, there is a rubric, general allergic constitution, chemical hypersensitivity. That's a rubric, chemical hypersensitivity. And in complete repertoire, the rubric, clinical, that is in the chapter clinical, allergy, chemicals too. These are the remedies represented for incomplete repertoire. So we have to select this rubric and find out which remedy out of this that is more suitable for your patient. And this is a case of chronic urticaria in one of our patients. And you have to select the rubric, skin eruption urticaria. In urticaria, always give importance to the sub-rubric, whether the complaints aggravate in the morning, evening or night, or after taking any type of food, or after application of the water, whether it will aggravate or not, etc. And there is a beautiful sub-rubric in synthesis repertory and also in complete repertory, urticaria chronic, urticaria children in, and urticaria with the different types of food. So that we have to select the exact rubric and medicine, then we will get the 100% result in chronic urticaria. And this is a case of collodion baby that's we treated in our OPD. Collodion baby, that's a congenital condition. And this patient is also, this child is also improving with our treatment. The rubric in this case we took skin eruption, scaly ichthyosis, general syphilis, eye aversion of the lid. That is also condition in with collodion, aversion of the lids, mouth, fingers in the mouth, children put. This child is always putting his fingers in the mouth. Skin dry, perspire, inability to, skin eruption, desquamate. These are the rubric we took in this case, and the patient is under silesia. The remedy is silesia. Now, how we will manage the mosquito allergy and also the bee stings? There are some people, they have severe itching, severe scratching, severe burning after the mosquito bite. And in this type of individuals, the pheromone level is very high. The rubric for the mosquito allergy is skin stings of insects. Ledum, Urtica urens, Staphysaccharine are the main remedies represented in cancer repertory. In majority of the cases, ledum will prevent the recurrence or the constitutional tendency to reaction from mosquito bite. Anyway, take the rubric, skin stings of insects. But if there is severe itching and burning immediately after the mosquito bite, then caladium is the best remedy, severe itching and burning. The rubric, skin eruption, skin stings of insects, severe itching and burning. That's the rubric mentioned in synthesis repertory. Now, how we will manage bee sting? This is a case of bee sting. It's very easy to manage. Apis, Urtica urens. These are the two remedies mentioned in our literature or in a repertory. The main remedy, that is Apis, bee sting. If the bite is because of some spider, then the remedy is Tarantula cubensis. Remember, Tarantula cubensis, not Tarantula hispana. Tarantula cubensis is the best remedy for the spider bite. And this is a case of hidradenitis suppurativa. It is very difficult to cure. We have 2 or 3 cases in our OPD. Hidradenitis suppurativa, constant discharge from this type of lesions from the axilla or from the inguinal region. It's a case of 4-year duration, a male case. Male of 30 years. Now the main lesion is on the axilla that aggravates since 3.5 months. The patient is with even though he is a young patient, the diabetes mellitus. with the discharge of pus earlier at the anal region 4 years back, now in the axillary region, once operated, again the complaint recurred. The conventional medicine have not definite treatment for this complaint, and there is a past history of epilepsy. The patient is still under the anti-epileptic medication, and the patient has had TB also 3 years back, and family history of diabetes mellitus to the father. And we can treat the family history also. There is a rubric in synthesis repertoire, generalities family history. And below that, there are a lot of diseases represented. Family history of cancer, family history of tuberculosis, family history of cardiac complaints in all members like that. So we took the rubric in this case, skin eruption separating, skin eruption hairy parts, urine sugar, general history, personal tuberculosis. General heat, sensation of silicea, nitric acid, natriumur, calcarea, carb are the main remedies. But this patient we prescribed initially silicea but without much benefit. When we prescribed 1 dose of syphilinum as an intercurrent remedy followed by calcarea sulf. We got good improvement from the calcarea sulf. Calcarea sulf is a specific remedy that is mentioned in our literature for the hidradenitis suppurativa. Hidradenitis suppurativa. Now what is this condition? This condition is called as miliaria. Miliaria. Don't worry, it is very easy to treat. Skin eruption, milia, rubra, children in. That's a rubric. In this case, whether aconite, chamomilla and sulfur. In many cases, chamomilla is sufficient. This is usually found in children, miliaria. And ask the patient, ask the mother not to apply any powder and wash the child 2 or 3 times daily. This is called milia. The rubric we already discussed in this case, milia. This type of lesion is very common in children. But when that's the main reason that occur when the dead skin become trapped in small pockets of the face. Baby acne. This is called as baby acne also. And the main remedy for the milia that is represented in our literature, that is calcarea iodatum. And remember, the cleanliness is very necessary in this type of milia. Ask the mother to clean 3 or 4 times with the mild baby soap. So calcarea iodide is the best remedy for milia in children. So this type of dyshydrotic eczema, that is nowadays very common. Dyshydrotic eczema. And the 2 reasons, one is stress and contact to some allergy conditions. Small blister like eruption with severe itching that will break, then there is no itching. Small itchy blisters on the hand and feet. So the main reason that's a stress and contact to some allergy condition. So the main remedy that is represented for this condition, that is Rustox. Even in synthesis and complete repertory, only one remedy is represented for dyshydrotic eczema, skin eruption vesicular, dry. Then how will work out the boils? Boils on the head. So skin eruption boils, that's a rubric, and give importance to the sub-rubric. The large boils, there is a rubric, and the small boils, there are some other remedies. And the clusters of boils, another group of remedies are there. So always select the sub-rubric in the case of boils. And there are 2 important remedies that is mentioned for this recurrent boils also. Sulfur and ferrum-picricum, I think these are the 2 remedies. Just refer the repertory for the recurrent boils. So select the sub-rubric. So these are all cases of the impetigo. That is very common in children because of the streptococcal infection. Nowadays it's a very concern, especially for the school-going children. So the most important remedy in this case anyway, that's antimonium crudum. That remedy will give result in majority of the cases, but depending upon the lesion you can select. Indented, inflamed, bad smelling, herpetiform with severe itching, then the remedy is sorinum. With much oozing, the remedy is sorinum, and again from scratching from sorinum is the remedy. So it is very easily manageable condition, but the hygiene that the child should maintain, proper hygiene. It's not a problem in homeopathy. Then it is prickly heat, otherwise called as sudamina, especially occur in summer. The rubric is skin eruption vesicular sudamina. So depending upon the nature of the sudamina, this prickly heat, we have to prescribe the remedy. Natriumur means like a sand appearance, natriumur. Hepasulf with pain. Rustox is a 3-mark remedy with severe itching. So in this way, we have to differentiate the medicines within the rubric and prescribe the remedy. In this case also, never apply prickly heat powder. Prickly heat powder will aggravate the prickly heat or suppress the condition. Ask the patient to bath 3 or 4 times, at least 3 times a day with a soap. That is sufficient in the case of the management of prickly heat. Never apply prickly heat powders as found in the advertisement. Then tinea cruris. In the chapter male, in the synthesis repertory there is a rubric, male eruption, genitals and thighs between. In female, eruption, herpetic, thighs between. Remedies are somewhat different for the male and female. That is represented in our literature. Tinea cruris, keep this area dry, never apply oil or never apply any cream or powders. So this is an interesting case of chronic spongiatic dermatitis that is admitted in the IPD of the Government Homeopathy Medical College, Calicut. This is a condition at the time of admission. See the following pictures. The patient gradually improved, and even the diagnosis that found defective in this case also. The patient is gradually improved to a great extent. Yes, in this case we took the rubric skin eruption psoriasis. We thought that this is a case of psoriasis because of the nature of the silvery white scales. But unfortunately we missed that psoriasis, that I will explain later. And the rubric in this case, skin eruption psoriasis, mind rage, mind occupation ameliorates. Rage means he has no control over his anger. Food and drinks, warm drink desire, salt desire, fish desire, heat and cold. Extremes of heat and cold aggravates. That's why we took the rubric generals called heat and cold. Then general sun exposure to sun. So initially we started the treatment with these remedies, and we took some more rubrics. When this case we didn't get much improvement, the additional rubrics: skin eruption discharging, extremities cracked skin of the hand, chilliness, skin inflammation. So this is a biopsy report of this patient. That means the dermis shows perivascular lymphatic infiltration consistent with the chronic dermatitis. That is a one biopsy. But after the second biopsy, there is the report, the diagnosis again changed. In this case, skin biopsy show features of severe spongiatic dermatitis. Severe spongiatic dermatitis. So sometimes this may happen also. So that is why we took the case again. And initially we thought that it's a case of psoriasis of 22 years duration. Started as contact dermatitis, more on the face and upper limb with the cracks and bloody discharge and pain. And the patient is under steroids. And there is a past history of chickenpox and electric shock. And also the family history of brain tumor for the mother. And this is a chronic smoker of 25 years duration. This is a fish. We prescribed Natrum muriaticum 0/3 and followed by Natrum 30. And after that, the patient has only some itching. Then we prescribed Sorinum 0/6 for the severe itching during sleep. And the patient is sleepless because of itching. Then the remedy mentioned in our repertory, that is Sorinum is the remedy, and we will discharge the patient with a great improvement. So these are some of the interesting and different types of cases that we usually encounter in our day-to-day practice, in our OPD, as a cosmetological or dermatological conditions. And many of the dermatological conditions are also cosmetological importance also, because the people are very much afraid about their appearance. They are very much concerned about their appearance. So this is a good field to start as a career as an homeopathic cosmetologist. You can start as a homeopathic cosmetology clinic. That will definitely improve within a short span of time. Now something about the dose and potency. Always give minute dose. Even though you are giving this 0/3, give only one pill. If you are giving CM potency or 10 potency or 200 potency, only give one medicated pill. It is better to avoid drop doses in cosmeto-dermatological conditions. So preferably one medicated pill. If you suspect some aggravation, dissolve that pill in half glass of water and take 1 spoon only, and ask the patient to discard the remaining water. You have to dissolve that one medicated pill in 1 or 2 ounces of water and take only 1 spoon of water only. Now what about the diet in cosmeto-dermatological conditions? Vitamin C rich food, like the citrus fruits, that is very good for the chronic dermatological, especially to improve the complexion in the case of acne, hair fall, etc. And also the patient need to take the green leafy vegetables and good sleep. That is an unavoidable thing to improve the complexion, to improve the acne, hair fall, etc. etc. So advise the patient to take this type of green leafy vegetables and vitamin C rich foods like the citrus, anar, etc. etc. and also good sleep. So I would like to conclude, homeopathy offers long-lasting relief to the chronic dermatological condition. That is a peculiarity of homeopathy, that offering long-lasting relief to the chronic dermatological condition. In allopathy system of medicine, when we are withdrawing the steroids or antibiotics, immediately on the next day the complaint will aggravate. Provide prescription should be based on the mental, physical generals and the nature of the lesion. Specific rubrics based on the nature of the lesion. So mental, physicals and the nature of the lesion, and avoid frequent repetition and frequent change of the remedy. These are the two things that we found in the new generation homeopaths. They are frequently changing the remedy and also frequently repeating the remedy. That should be avoided in chronic dermatological condition. Medicine is our passion, humanity is our religion. And for the best result in homeopathy, read this paragraph carefully. If you neglect making a careful case taking, the patient will be the first sufferer. But in the end, you yourself will suffer from it. That means you lose lot of cases. And ultimately, the people will blame homeopathy also. So in order to get good result in homeopathy, even though you have good knowledge in the materia medica, practice of medicine, repertory, organon, etc., if your case taking is not perfect, we will never get the desired result. And remember the aforesaid number 5 also, useful to the physician in assisting him to cure the particulars of the most probable exciting cause. That is especially needed in acute disease, etiology. In chronic diseases, to enable him to discover its fundamental cause, which is generally due to miasm. And the next paragraph is very important. In this investigation, in chronic disease, the ascertainable physical constitution of the patient, its intellectual character, his occupation, his mode of living, habit, his social and domestic relations, his age, sexual functions are to be taken into consideration. Then we will get good result in the chronic complaints. Please visit our website, homeobook.com. I think many of you are familiar with this website. This is the largest portal on homeopathic education in the world. More than 5,000 PowerPoint presentation, 2,500 plus articles. And the materials for the study materials for the first UHMS to PhD, that is available in our website. And this is the largest placement portal in homeopathy also. A lot of competitive examination materials from the first BHMS to PhD. And there is a separate section for the scope of homeopathy across the globe, how you can practice homeopathy in different countries. And I would like to give you some good reference books. If you would like to know more about the cosmetology, like to know more about the dermatology, how to manage it homeopathically, what are the general managements of this cosmeto-dermatological complaints, then please go through some of the best books. Color Atlas of Dermatology by L.K. Botani. This is one of the famous book. And the textbook of dermatology for homeopathy. This is by an allopathy doctor and a homeopathy doctor, our former CCRH director Dr. R.K. Manchanda, and an allopathic dermatologist, Ramji Gupta. It's a wonderful book. And Diseases of the Skin with the Homeopathic Management. This is a very good book for managing the cosmeto-dermatological complaints. This is by the former professor of the Government Homeopathy Medical College, Dr. K.S. Gopi. Hair Problem Answered with Homeopathy. That's by the medical officer Dr. Shivakumar. Was a PG scholar of the Government Homeopathy Medical College, Calicut. Then another book, Illustrated Textbook of Dermatology by Dr. Pasrika. All these books are available online. Try to purchase this type of books and the study in subject in detail. And that's all for the time being. If you have any doubt, you can just give type on the comment box. We'll give you the reply. And your comments and suggestions are also welcome. And please subscribe to our channel, this YouTube channel. You will get more videos like this, and also our Facebook page, eHomeopathy, with more than 50,000 followers are there. And part 3 of this presentation will be uploaded soon in the YouTube. So be with us, and that's all for the time being. Thank you.